Good evening. In a landmark ruling, the Supreme Court today legalized abortions. The majority in cases from Texas and Georgia said that the decision to end a pregnancy during the first 3 months belongs to the woman and her doctor, not the government. Thus, the anti-abortion laws of 46 states were rendered unconstitutional.
We begin in Texas, where one of the strictest abortion laws in the country is now in effect.
What people say when they're reaching out desperate for help. So there are societal issues we need to fix around child rearing, child raising, making it easier to have a child.
At this time in my life, I don't have a handle enough on my disease to be able to confidently be able to say, yeah, I can take care of this and take care of a child.
It's not an easy thing to be a mother.
The law, known as SB 8, bans abortions after 6 weeks of pregnancy, which is a point when many women don't even yet know they're pregnant. It also allows anyone who helps a woman get an abortion to be sued, and those who are successful in their lawsuit could win at least $10,000. The ban went into effect at midnight after the Supreme Court did not act on a request to block it. It comes as state lawmakers set a record this year for the most abortion restrictions signed in 1 year since the case Roe v. Wade was established in 1973.
The Texas Heartbeat Bill is now law in the Lone Star State,
Which outlawed abortion after about 6 weeks in Texas.
And the smart thing they did was
To sue anyone who goes and gets an abortion and anyone who aids in getting that abortion.
It could be a potentially dangerous precedent to start making laws like that.
So first of all, we need to pray, then we try to teach them, and by example, really what it means to be really gentle and pacific in the midst of hostility and anger.
And so to be pro-life is to support women in being able to embrace new life within them. Is really about respecting the life of every person, really recognizing that every life is good, every person matters, their life matters. When I worked in our visitation mission, which is our mission particularly to women in crisis pregnancies, and I was working directly with women who were pregnant, and many of the women we served chose life, but some of them didn't. And I remember just witnessing the effect. They will definitely come. Sometimes they just come once during their pregnancy saying, you know, I just need some baby clothes and diapers. But often we'll continue to walk with them for several years after the pregnancy, and they'll keep coming back for diapers and baby clothes. And a girl like that needs a lot of support.
the way to help people not regret their abortions or not be pressured into abortion is by providing support. When you're someone like me who's like an illegal abortion provider, I ship pills to people who need them. These people, and some of whom I've been able to luckily help, ask strangers on the internet for pills and are willing to sit there and wait for pills from a stranger from the internet to arrive in their mailbox. Take them based on the websites. Even I give them Plan C websites, which is a very reliable website for how to do your own abortion. They take these pills from this stranger on the internet. There's no way they know. They're taking these huge substantiated risks because the traditional medical system is not equipped to take care of the marginalized community. The accessing of the procedure becomes 1,000 times more complicated when you throw in the protesters, when you throw in who knows. In states where they have waiting periods, if you're in an abusive relationship, you have to explain a potentially abusive partner why you're sneaking away twice. You're able to go to an accessible clinic that's legal, that's staffed by trained officials and trained healthcare professionals. They screen you. They have to screen every patient. It's one of the basic tenets of healthcare. The more accessible you make abortion, those regretful numbers go down. Pro-choice effectively means like being there for someone making their own decision, letting people have a choice and not forcing them into a dangerous medical situation that they don't want against their will.
It's about knowing that your choice is yours and you can't make that for someone else. But it does leave a lasting emotional burden on you. Before the Texas law went into effect, I had the worst experience trying to just get in somewhere. There really wasn't anything there. It was like the size of like a gummy bear. And they started calling me mom and all this stuff and like saying like, there's the heartbeat. And that was very uncomfortable because apparently in Texas, it's the law. 3 weeks out. So I would have been almost 12 weeks along. And I really did not want to do the surgery. And it's like, I think 10 weeks is the cutoff for the pills. And then I would have had to wait 24 hours after the initial visit to actually have it done because they force you to look at the sonogram and then you have to wait 24 hours and then come back and have the procedure done. But I ended up getting in sooner at a clinic in Oklahoma. So I actually had to drive all the way up to Oklahoma, get a hotel room. And then I went in there and there was protesters everywhere outside the clinic. And I was there for, I think, probably like 6 hours. And a lot of that was just waiting in the clinic to be seen by the actual doctor. And then I got the pill and I took the first one and I went home and I took the 4 that you put in your cheek. And it was like a miscarriage. I've had a miscarriage before. It was very much like that. It was extremely painful. The second time I was like at 5 weeks. I managed to get it done really quick. The surgery was really quick. I was in the clinic for maybe an hour waiting because this was after the 6-week ban went into effect. And so there was a whole influx of donations made to Texas residents so that they could get abortions. So my second one was completely covered out of pocket. My first one was like $700, I think.
It's true that women need more equality in the workforce. There needs to be paid maternity leave. It's like we both recognize the same problem, that women experience guilt and pain after abortion. And many women aren't aware of it or they try to deny it, that the slogans and the things you hear are not at the root of what this is about. What I think it's about that there would be support to women, for every woman.
I hope that I want the stigma to go away. People could start to understand the reasons why it's needed and why it's needed in a safe way.
I would like to see the Women's Health Protection Act passed, and I'd like to see abortion pills be over-the-counter medications. Create things like affordable housing, accessible food, accessible childcare, and just basic respecting of people. My God.